Good afternoon and welcome to the University of Michigan School of Public Health Graduate Information Session. My name is Beth Carroll and I'm the Assistant Director of Student Affairs. This session will be primarily geared towards Masters of Public Health and Masters of Health Services Administration prospective students. This webinar will include information about our 6 departments, including our online program and application process. At the end, 2 current student admissions ambassadors will join us. This first slide here addresses what is public health. Public health is defined as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. Public health is all around us. It's the quality of the air we breathe. It's the flu shot you get at the pharmacy. It's the ethics of genetic testing. It's the creation of policies that govern healthcare. If you hear about something in the news, it's likely that there is a public health angle to it. So here's the common denominator. Everything we do in public health is about improving the health of people at a population level. Michigan Public Health is pursuing a healthier, more equitable world through education, research, and action. Included on this slide are the 6 graduate academic departments where students can focus their degree. In addition, the Master of Health Informatics, a joint degree with the School of Information, is also listed here. There's no specific undergraduate degree or set of professional work experience that's required. However, some of our departments have recommended and required courses that they're looking for. There are endless opportunities within the field of public health, and you're bound to find your niche. In 2018, the top 4 employment sectors included hospital and healthcare providers, academia, consulting, and private industry. On this next slide, we'll get to know the School of Public Health a bit more. Here are some numbers about our school. There are about 1,300 current public health students. This includes graduate residential and online students, as well as undergraduates. We have around 170 faculty, and if you're interested in research, we have 34 research centers. As a graduate of the University of Michigan, you become part of one of the world's largest alumni networks. As noted, we have a faculty to student ratio of 9:1. I think when people think of the University of Michigan, they think about a large university where they're just a number, and we really strive to support students from all angles. As a public health student, you'll have access to support services at the university, at the school level, as well as within your department. And all of our students are assigned a faculty advisor. This next slide speaks to the school's various degree programs. First, I'll draw your attention to the degrees listed under professional. The Masters of Public Health is our flagship degree. We offer a residential program in Ann Arbor, and that's 2 years and 60 credits. We also offer a fully online program, and that's about 20 months and 42 credits. A Master of Health Services Administration is available within our Health Management and Policy Department. If your interests are more research-based, we offer a Master's of Science or PhD program. Both of those are administered through departments and the Rackham Graduate School. The university is made up of 19 schools and colleges, and as a public health student, you can take courses at any of the schools. With 97 graduate programs ranked top 10 in the country, you have the ability to learn from leaders in other fields. As you can see, the school has 7 formalized dual degrees, and students interested in applying to dual degrees should apply to each school separately as a normal applicant. And then if you're admitted to both, you're able to complete 2 master's degrees in 3 years. The Masters of Public Health and Masters in Health Services Administration application is administered through SOFIS, which is the common application for schools of public health. All supplemental materials need to be sent directly to SOFIS. And there are 2 required essays, as noted here. The first is our SOFIS Statement of Purpose. And within this essay, we want you to address why Michigan Public Health. This is also a great place to talk about any future goals or aspirations. And this is really where faculty hope to hear your voice come through. And we really encourage you to take your time when it comes to this piece. The second of the 2 essays is the reflective essay, and within this essay, we want to know what specific characteristics or experiences do you have that can contribute to our community, and also if there are any areas of concern with regard to the application. So for instance, if you have a low GPA or lower test scores, this is where you'd want to address that. Next is the resume. Here I encourage you to highlight your academic accomplishments. You'll want to list your relevant courses, any awards, or relevant research. Next would be our letters of recommendation. We look for 3 letters. Ideally, we're looking for 2 academic and 1 professional. Definitely when it comes to letters of recommendation, think quality over quantity and stick to 3. When it comes to academic, we're looking for a professor or someone who knows your academic capabilities And when it comes to professional, we're looking for somebody like a boss or a coach, someone who's able to speak to you having integrity, ethics, and things like that. Lastly would be test scores. A standardized test is required for all of our departments, and all of them except the GRE. In regards to the MCAT, all of our departments except health management and policy and biostatistics. There is no minimum score required. This next slide speaks to your background and your experience. We encourage you to incorporate all of the extracurricular activities you've been involved in, including research, professional, service, and volunteer. All of the application components listed here are taken into consideration. There's not one thing that's going to make or break your application. Faculty reviewers are looking for the total package. As a school, we practice a holistic review process when making graduate student admission decisions. Holistic review ensures that no single factor leads to either accepting or excluding a student from admission. Let's take a turn now and talk a little bit about the application timeline. Currently, we're accepting applications for the residential program for fall 2020. The online program application opens on November 1st, and as you can see, we have various deadlines, so I encourage you to review this slide as well as our website. Here's a breakdown of each program's timeline. As mentioned, our graduate residential program is open now. The priority deadline is December 1st, and the hard deadline for health management and policy and international students is January 15th. After that, for the residential program, applications are reviewed on a rolling admissions basis, and they close at various times based on when the department feels as though they're at capacity. Looking at the online graduate program, as mentioned, they'll be opening November 1st, and their priority deadline is February 15th, and they do have a hard deadline, and that's May 1st. As mentioned earlier, the MS and PhD programs are administered through the Rackham Graduate School in each of our departments, so you'll want to be sure to visit their webpage for more information about their application and timeline. We recognize that cost plays a large role in your decision-making process. We encourage all students to complete the FAFSA form. Your SOFIS application serves as your application for our Dean scholarships. There is no separate application. Once you're admitted, you'll be evaluated for our Dean scholarship, and communication regarding scholarships typically comes after your admission decision. About 35% of our students receive some type of award, and we award about $4 million each year. This last slide includes key staff members who are available to assist you through the application process. Please don't hesitate to reach out if you have any questions. It is truly a team effort when it comes to the application process, and we're happy to help you along the way. During this presentation, we also wanted to highlight an event that we have coming up. If you are local and you're able to make it to Ann Arbor, we have our Prospective Graduate Student Day coming up on Saturday, October 19th. This event is a one-stop shop for all of your questions. You'll be able to hear from school leadership, meet with department staff and faculty, and also hear from our alum and current students during a panel session. We hope to see you there, and registration information is available on our website. We have two students joining us today, Nick and Cindy. At this time, I'll have both of them introduce themselves. They'll share their name, their department, the undergrad institution that they attended, and their undergraduate major.
Hello, everybody. My name is Nickolas Dolnicek. I am currently a second-year student in the General Epidemiology department. I actually, believe it or not, went to undergraduate school here at the University of Michigan, so I've been stuck here for the last 6 years. And my undergraduate degree was in movement science in the School of Kinesiology.
Hi everyone, my name is Cindy Lay. My pronouns are she, her, hers. I'm a second year in the Health Behavior and Health Education department. For my undergraduate institution, I went to Rutgers University and I pursued a Bachelor of Science in Public Policy.
Great, well thank you guys for joining us today. And for those of you who are logged in, again, please feel free to utilize that chat box. We're happy to answer any questions that you might have. While you are thinking of some questions, a question that I have for both of you would be, what type of advice would you have for those who are going through the application process right now?
Well, I think the first thing that I would recommend is that know how much time you need for your application. So I'll give you a little bit of my experience. I actually took a gap year between my undergraduate and my graduate school, and I thought for me that was really valuable to get my thoughts together, think about where I wanted to go in my life, and kind of get all my information together for my application. For some people, you might not need that, but for me, I really thought that extra year of getting work experience, and getting all my application information together was definitely really helpful.
For me, I came straight out of undergrad to Michigan. During this whole process, I'm a first-generation undergrad student as well as graduate student, and I really had a lot of imposter syndrome during this process, and that impacted me in terms of when I was able to submit, because I thought I submitted late. But thankfully I got accepted, and I was even offered a scholarship that made coming to Michigan possible. So I just recommend to y'all that whatever thoughts that you're having that you're not good enough, just try your best to get rid of that, because you are good enough. You should just try to start early.
Yeah, definitely great advice. What about for those who are thinking of maybe taking a gap year? Nick, any thoughts about that after your experience?
Yeah, so I think for me, I think I took a little bit of an unconventional route. I think a lot of people that take gap years, they think about what type of work experience they might look for a public health career. For me, I thought that it was good just to take some time off of school, think about, I didn't really know where I wanted to go with my education. So if you're interested in a public health degree or any specific career, I would definitely recommend trying to get involved in any way you can, whether or not it be through research, through a university, or through any other type of career experience you can get. Definitely really helpful.
Great, thank you. Would either one of you mind sharing the types of different organizations that you're involved in outside of the classroom? As staff here, we really want to ensure that our students are engaged, they're connected, and they feel a sense of belonging both inside and outside of the classroom. We have over 30 student organizations, so I think it'd be helpful to hear what types of things are going on outside of the classroom.
I guess for me, I serve as the student representative for the Health Behavior and Health Education Department for the Diversity, Equity, and Inclusion Committee. So we work on striving to create a community where we can impact culture and practice, as well as disseminating information to make sure that SBH is an inclusive environment and we're pursuing equity and diversity in all that we do. So that's been a great experience in terms of finding community and people who strive to make the world a better place and share the same values as me and make me feel so welcome. So that's a great experience, as well as I pursue research at the Prevention Research Center. So we look at gun violence prevention, focusing on youth in schools. And it's a really personal aspect for me because I'm from Camden, New Jersey. And being able to pursue this work and make sure I equip myself with skills necessary to give back at home has been amazing.
Yeah, I guess a little bit about me. Just being here, I'm a part of the admissions ambassadors. So I like to talk to prospective students like you guys. I'm also part of the first and second year mentorship program. So I really like to share my experiences with other students about their future directions and how they can reach their goals. I'm actually also interested in part of the Injury Prevention Center, and my interests are more so involved in concussion research and motor vehicle accidents. Originally, being a kinesiology student, I was solely interested in athlete health, and I'm still interested in that, but I think also expanding my research interests towards motor vehicle crashes and other types of brain injuries has really helped me.
Great, thank you. We do have a couple questions that came in via the chat box. There's a couple in regards to PhD programs, and I'll let Kristen tackle that. In regards to the PhD programs, you're going to want to talk to your program coordinator. They're the department representative who leads that within each department. So that's a great place to start for any questions that you have related to that. Another question here from Bethany in regards to MPH programs and being able to switch between departments. There are instances where students will apply to a department and then want to switch to another, and usually that's handled on a department level. We work with you to try to accommodate that request, obviously within reason. So yes, that is something that's able to happen, but again, that's on a case-by-case basis. Another question here in regards to global health. Do either of you want to address anything like that going on here at the School of Public Health?
So I can talk a little bit about it, not being part of it myself. We have, as part of the epidemiology department, we also have a global health epidemiology. And so as part of that program, all those students undergo a internship in the summer after their first year. So they all go to a foreign country to pursue a public health interest of their choice. There's also vast other opportunities in research and other professor opportunities to go through global health. So that's definitely something you're interested in. I definitely say this university is definitely where you want to be.
I don't really have experience with global health, but a few of my peers have been able to get resources and be given opportunities to study abroad. One of my close friends in my cohort, she was able to work at the UN in Colombia this past summer for her internship, and she receives support from the school in order to make that possible. There are opportunities here.
Another question here is in regards to average GPA, also a question about standardized tests. So we touched on that a little bit during the presentation. Typically, it's a minimum of a 3.0 cumulative GPA to apply. On average, admitted students are between a 3.4 and a 3.5. Again, those are averages just to kind of give you an idea. In terms of the standardized test, I always encourage students to shoot for at least the 50th percentile. There's no minimum, and of course, again, the averages are just to give you an idea. So that's something definitely to keep in mind. Also, a lot of students take the standardized test more than once, and know that that's definitely okay.
And let me just touch upon that.
Yeah, sure.
The GREs are not your worth, and you shouldn't stress that much about it, because I've had peers who are in PhD programs who are advising me as I'm about to apply for PhD programs as well, in terms of they've gone into full funded package programs with GRE scores underneath the 40th percentile. So it doesn't make or break you. You can still get in and you can still have a promising career without scoring really high. So don't stress it too much.
One thing that I talked about during the presentation was the interdisciplinary nature of the University of Michigan. And as a student at the School of Public Health, you're able to take classes at any of the 19 schools and colleges. With that being said, is there a favorite class that you've taken outside of the school that you've really enjoyed?
So I think I can talk about, as an undergraduate student here, one of my favorite classes as a kinesiology student was one of my classes with Dr. Stephen Brolio in concussion research. And we talked a lot about athlete health and concussions, and that kind of spurred my interest for how can I take a public health degree and kind of tackle this emerging public health issue. As I mentioned before, I'm part of the general epidemiology department, so although not quite to your question, one of my favorite classes as a public health student was actually in the HPHE health behavioral health education department, and that was a course in general injury prevention topics, and we talked about topics ranging from gun violence and gun injury prevention to motor vehicle accidents to sexual violence and sexual assault prevention. So definitely had lots of opportunities outside your program.
I haven't had the opportunity to take classes outside of the school yet, but a lot of my peers have enjoyed taking classes in the Ford School. In the School of Social Work, they have mixed methods courses. There's a course, I think, in the School of Law about poverty and inequality that's really good and thoughtful. But there's plenty of opportunities, plenty of classes. Just have to make it work.
Yeah. What about in terms of accessibility to faculty? I mentioned during the presentation that all of our students are assigned an advisor. Any thoughts or comments to those who might be logged in wondering what it's really like here?
Yeah, so I think one thing that should be noted is that I think people have this idea that professors aren't there to help students, or that there's a super competitive environment between all the students, and I would just like to say that's completely false. From my experience, all the professors, they love helping students, especially if you have a particular interest that they share. Shoot them an email, tell them, talk to their office, or talk to them in their office, say, hey, I'm interested in your research, and they love talk to students that are interested in something similar to them. So if you're ever afraid to talk to a professor, just know they're definitely there to help you.
I 100% agree. That's really a primary factor of why I chose Michigan, because all of their faculty members were welcoming and accessible. I've been able to meet pretty much anyone that was interested in the department and the school, outside of the school, and they've been really welcoming in terms of scheduling something, and I was able to work with one faculty member on research, and she helped me get funded to go present at a conference for her. So it's all the faculty members here are welcoming, and they can provide you with so many opportunities.
Great. So looking at some of the questions here that have come in, one is in regards to graduate assistantships, and those are available through the University of Michigan. If you want to check out the website umjobs.org, you'll be able to see relevant position postings that are updated pretty frequently. Anything else that you guys want to add in terms of employment or graduate assistantships?
I would say so. In my second year, I've been focusing mainly on my studies. I think certainly plenty of students definitely do pursue job opportunities. I would just make sure to understand what you're capable of, what you think you can handle. For me, I thought that at least in my first year, I would prioritize on my academics, and certainly once you kind of get a handle of how much of school commitment you have, then exploring outside of the school and seeing what else you can do.
100% agree on that. Just balancing yourself out, because you're coming straight in all of those courses, you kind of underestimate how much you're taking on. And I understand that you might be facing a financial burden. So that's something you might even want to talk out with your advisor in terms of balancing that out, in terms of finding opportunities that could work well with your schedule and your load. Just seeking advice here is very welcome.
And I'd like to just add one more thing, kind of expanding on the student organizations. I think it's really easy, especially coming onto campus for the first time, want to get involved in everything. So because we have so many student organizations and so many opportunities and so many research opportunities, it's certainly easy to think that you can do everything. And while yes, absolutely explore your interests and do new things, but also keep in mind that we're students first, and we all have our limits.
Great advice. Thank you both. Another question here in regards to certificate programs, and that's one thing that we haven't touched on yet. The School of Public Health offers supplemental certificate programs where students can group together a specific set of required courses and elective courses so that they graduate then with a degree within a specific area. Some of those in the past have included genetics, risk science, and injury. So a lot of different offerings here at the School of Public Health, but also at the Greater University of Michigan too. Are either of you pursuing any of those certificates or have any thoughts in regards to that?
I'm not at the moment pursuing one. I think as a first year student, I was interested in the injury science certificate, and I think that definitely exploring those opportunities. I think one thing that we were at least spoken of is that there's a expectation of a lot of students that I have to do a certificate. It looks good on a resume, and I think absolutely, if that's something you're interested in, go for it. But by no means does a Master of Public Health from the University of Michigan look any different if you do not have a certificate. So I think if I don't have one, I won't be any worse off.
Summarize it all. It's all good.
And Kristen will put a link up to the certificates that are available at the School of Public Health as well as around the university. And the nice perk with those as well is that they usually don't cost more money or take more time. Really, the strategic piece of that is knowing ahead of time what it is that you want to accomplish and meeting with your advisor and being thoughtful in terms of course planning. Another question here in regards to, let's see. Can you pursue 2-degree programs? So Bree, if you could clarify a little bit in regards to your question, I think that would be helpful. We have had students do dual degrees among different departments, so that is a possibility. Yep, so like HBHE and EPID, yep, that definitely could be a possibility. What I would encourage you to do is to reach out to our team at sph.inquiries@umich.edu, and we can put you in touch with the staff members who you need to talk to about that. And I think that raises a great question and something that we haven't really talked about yet. And that is that we get applicants from a lot of different areas who are applying to multiple departments. So know that that's definitely something that you're able to do, because we understand, like I mentioned at the beginning, that public health is a very diverse field and that you're going to have a lot of different interests. And there are some ways in which those kinds of themes are parallel and they intersect. So with that, you're just going to want to be very thoughtful and make sure that your essays are tailored specifically towards the department in which you're applying to. Any other thoughts about that as far as different interests within public health, or even just how your interests have maybe changed as a second-year student here at the school?
I think I touched on it a little bit earlier, maybe not specifically to my first and second year, but as an undergraduate student, as a kinesiology student, I was really interested in how can I improve athlete health, and this topic of concussions and all this stuff I was really interested in. And I think pursuing this public health degree has kind of broadened my scope of that a little bit, from not only thinking about how to limit concussions in athletes, but also maybe motor vehicle accidents are important, or I guess other opportunities to more broaden my scope of injury prevention just as a whole.
For me, during my undergraduate education, I was pretty much all over the place in terms of my interests. I knew a PhD was down the line for me, but I was still all over the place in terms of gun violence work, mental health, communities of color, and urban neighborhoods. And once I got to SPH, I was able to take a lot of classes, able to speak to so many faculty members, and I've been able to hone in on my skills in terms of how can I give back to my communities through a PhD. And now I've come to start beginning to look at how do we examine how structural racism impacts the mental health of communities of color, and how can we address it at all levels, from the individual to the structural.
Thank you. Carrie, I saw your question in regards to pursuing a dual degree with health management and policy and the Masters of Health Informatics. You're going to want to talk to the MHI program specifically, and that program coordinator is TJ Shannon. Kristen will share that contact information with you, and he'll be able to speak to the specific requirements as well as the application process for that. There is a health informatics certificate, if that is of interest to you too. It's nice to have different options. So we are at just after 12:30. So if you have any additional questions, please feel free to utilize the chat box. We're happy to take those before we sign off today. One other question that I have for you guys, and those of you probably logged in, if you aren't from Ann Arbor, you've probably seen Ann Arbor at the top of quite a few lists as far as one of the best college towns, one of the best educated cities, those types of things. But to both of you, what is it like living in Ann Arbor? What types of things are you involved in? What do you like to do?
Yeah, so I think I can talk a little bit about that. So like I mentioned earlier, I also went to undergraduate school at the University of Michigan. So I've been in Ann Arbor for a long time. But some of my favorite things about this campus are not only the college to feel about, but also, I guess, talking a little bit about the School of Public Health, knowing that I'm a part of a tiny school, but in a big university. So one of my favorite things to do is walking through the middle of campus and just seeing what's going on. And we have this little area called the Diag where everything kind of comes together. And there's always a student org, there's always something going on. So I always love doing that. If you didn't know, also the University of Michigan has the largest sports stadium in the country with only 110,000 people. So I highly recommend doing that. Besides that, just anything you can get involved in, whether it be through the school or outside the school. The restaurants here are fantastic. I can recommend a few. Everything here is great.
100% agree. For me, there's two things I like to do: nature and food. So there's definitely lots of places that I love to go to. Sushi Town is just a great place for me to feel welcome and at home. And there's Frito potatoes, and I love my bubble tea, whether it's chai time or cocoa. And in terms of nature, we have the Nickolas Arboretum right behind SPH. It's just a stroll right behind there. And it's always really relaxing to just get away for a second, as well as during the fall, the leaves change colors and it's just so beautiful.
Great, thank you. So that's the conclusion of our questions at this point. It doesn't look like there are any more in the chat box. Before we sign off though, one last question for you, Nick and Cindy. What piece of advice would you have for our students logged in?
Which one? I mean, there's so many.
Yeah, in terms of maybe something that you could tell your former.
Yeah, so when I think back to my former self, I think definitely telling my former self to get involved as much as you can. So I think I've done a better job at getting involved as a graduate student, as an undergraduate student, but I think the more you can do and kind of expand your boundaries to get to areas that you haven't particularly thought about before or anything like that, I think definitely go ahead and do that. I know you've probably heard similar advice from your undergraduate, but it still applies to grad school, even if it's a different title. So
for me, it's just battling that imposter syndrome, that self-doubt. Don't listen to it. You're enough. The only way you're not getting in is if you don't apply. So definitely apply, check it out. And when choosing your program, when you get all of your acceptances, just make sure it's all about community and faculty, and just that's it. So just making sure you have that support system and it's welcoming and you can be able to achieve all that you want to do.
Well, thank you. And thanks to all of you for joining us this afternoon. We hope you have a great day. And if you have additional questions in regards to your application process, please feel free to email us at sph.inquiries@umich.edu. We look forward to connecting with you soon. Thanks so much and have a great day.